Facebook, hello, I'm John Bocanegra with KCBD, and on today's Facebook Live, Samantha Ybarbo is talking to you and to me as well about how Lubbock Heart and Surgical Hospital is staying safe during COVID-19 and beyond, since we know things are starting to open back up. Samantha is a clinical manager with Texas Physicians Group, an affiliate of the Lubbock Heart and Surgical Hospital. Glad you're taking time out of your day to join us.
Yeah, thanks for having us on. We're happy to provide any education we can for the community, and this is one good way to get that stuff out
You picked the right way, by the way.
there.
So
Yeah.
let's just get right into this. I'll ask you some questions, 3 of them. And if anybody on Facebook has questions as well, be sure to get those in the comments and we'll get back to them as quickly as we can. So, what screening measures are in place for patient and employee safety, especially during these times?
Okay, so we've done a lot over the past month, screening process-wise. Everybody gets screened at the door. We're doing a travel screening, where do you live kind of screening, making sure that we don't have any patients or visitors that come from any type of nursing homes or group homes, just so we can put a little bit more precautions in for those people. The screening takes about 2 minutes. It's a questionnaire, and then any yeses or any determinants off of that questionnaire will go directly to our infectious disease coordinator and our infectious disease director, and they'll kind of let us know if there's any extra precautions that we need to take. Currently, our patients that are coming in for surgical procedures at the hospital, they're getting a pre-screening that's done before they even enter the building, so we can go ahead and screen them over there. Here at the clinics and at all of our clinics around town, we're screening the patients as they come in. We're limiting visitors in our waiting room, so we like to ask visitors that they wait in the truck. We are allowing 1 visitor now at the hospital, so there is 1 determined visitor for every patient. They are allowed, but they get screened as well. We're doing temperature checks. All of our employees are following the rules as well, so they're getting screened at the door and having their temperature checked daily. They're getting screened pretty frequently throughout the day, depending on where you work. Masks are recommended. We're going to ask everybody wear a mask whenever they come in. That's to keep everybody safe, kind of keep y'all safe from our germs and us safe from yours, so that we keep our environment safe within our clinics and within our hospital.
It's weird that it's standard procedure now, all of these things, but if we know that you're doing the right thing on your part to ensure safety for everybody, I think that puts a little bit of everybody at ease, I think.
Yeah, I think so too. I think, the more we see all of these implementations go throughout the community, like people are wearing masks everywhere, and cleaning their hands frequently and things like that. I mean, we'd like to think that they were doing that before, but now that we know it's a thing that everybody has to do, it's nice to see that we're keeping everybody safe on our end too.
Talking about appointments, why is it important that patients maintain those times with their specialists?
So we have all of our specialist clinics. So we have a clinic with an endocrinologist, and that's Dr. Felton. So it's really important that people come in and see her, keep those annual appointments to manage all their chronic conditions and keep their medications managed as well, especially with our cardiologist office here at Cardiologist of Lubbock. It's really important that they keep those scheduled appointments, come and see those physicians, just because management of the chronic conditions is really important right now. And I know people are scared to go out, but that's why we've put these screening processes in place. And then, we don't recommend that anybody come to the clinic for any chest pain, shortness of breath, anything that's emergent, but we want to be sure that they know that we are open, we are seeing patients, and we're doing everything we can to keep everybody safe.
You mentioned a little bit about acute symptoms. Should a patient not want to rush back out, and this is kind of more important with everybody trying to stay as safe as possible, does Lubbock Heart and Surgical Hospital, as well as Texas Physicians Group, offer any remote services of any sort?
So we are offering telehealth at all of our clinics. So our primary clinics out is offering telehealth services. Our specialist clinics, which is our endocrinologists and our cardiologists, they're all offering telemedicine services. So these visits are set up through the office just as if they were going to come see the doctor. And then we send them emails to generate those communications. So they get the email for the communication. We can see them on the screen just like I'm talking to you. The physician can go through a list of symptoms, can go through a list of past illnesses and things like that. And they can do the visit just as if they were in the office. The only difference is they can't put their hands on the patient. And then if there's anything they see like during those visits, they'll recommend that those patients come in afterwards just to kind of get checked out a little bit further. But we do have those telehealth visits in place at all of our facilities right now.
Remember, Facebook questions and comments, even after this video is over with, we'll get to them as quickly and as best as we can. Samantha Ybarbo, thank you so much for taking time out of your day to join us.
All right, thank you for having us, and we look forward to seeing all of our patients back to the new normal, I guess we should say.